Good morning, ladies and gentlemen. I'm Elaine, and on behalf of Murdoch Consultancy, I would like to thank the National University Health System in accepting our recommendations to managing risk in this institution. In this video, I'll be addressing three key main areas. 1. The importance for NUHS to strategically manage risk. 2. The key components of the recommended risk management framework. 3. The key steps in the implementation process. The reorganization of Singapore's public healthcare system in January 2017 aimed to improve accessibility, affordability, and quality of healthcare in Singapore under the Healthcare 2020 Master Plan. As Singapore population ages with increased chronic disease burden and healthcare needs, there is an exigency to manage future growth in healthcare manpower and spending. The NUHS Regional Health System envisions to build a healthy and engaged population in the West with the formation of NUHS RHS Advisory Council, which comprised of partners from public, private, and people sectors. There are also continuous collaborative efforts with Jurong Health Services to provide an integrated, seamless, and affordable healthcare for residents in the Western region. Alexandra Hospital has been officially operating under NUHS since August 2018. It is the first integrated hospital to provide one continuum of care with foci on team-led and program-based clinical models of care. Risk is the uncertainty inherent in potential outcomes for a business entity. Risk management is the ability to balance potential for loss and opportunity for higher profit and growth. In the past 2 decades, strategic risk management has evolved from a piecemeal approach to a holistic approach that encompasses enterprise-wide risk. Traditional risk management was fragmented as various departments within corporations dealt with different parts of risk management tactically and utilized tools independent of others. Consequently, critical risk management and risk return issues were not presented to the board in a comprehensive and strategic manner. Though the constituents of enterprise risk management remain debatable, there are 3 core elements of enterprise risk management. They are 1. Managing corporation risk is more efficient than individual subsidiaries. 2. Enterprise risk management incorporates traditional risk and strategic risk. 3. Firms with capabilities to manage risk should seek competitive advantage from it. The objective of this strategy encompasses an integrative and consistent approach to risk management across all levels of NUHS. Risk management is the responsibility of all employees, and all staffs are expected to actively ensure the operationalization of risk management in their work area. An open culture is required amongst all employees, contractors, and parties working within NUHS for systems and structures to operationalize. Managers at all levels are expected to apply risk management in their approach to clinical and corporate governance. NUHS is committed to implementing a risk management culture that underpins and supports its business. There will be ongoing commitments to improve risk management throughout the organization. Patients, visitors, staff, management, and the board will not be surprised by foreseeable risk. Strategic and business risks are embraced and explored to grow business and services. The primary aim is to reduce risks that impact on safety and reduce financial, operational, and reputational risk. Risk-taking will be considered within authorized and defined limits with experimentation and innovation. Senior management will lead change and be of exemplary behavior in identifying, assessing, and managing risk. Line managers will encourage risk identifying amongst staff. Staff will not be chastised as being negative for identifying risk. All employees in NUHS are encouraged to identify risk. They are aware and understand the risks that affect patients and visitors. All employees will be competent at managing risk with access to comprehensive risk guidance and advice. Specialist training will be provided for identified employees to enable them to fulfill their responsibilities. There will be continuous communication between staff, stakeholders, and partners. Risk appetite statement of NUHS is the appropriate exposure of risk the organization will accept to deliver its strategy over a specific time frame. The organization's risk appetite include the nature of risk to be assumed, the amount of risk to be undertaken, and the desired balance of risk versus reward. NUHS will publish its risk appetite statement annually on these four areas: risk to patients, organization risk, reputational risk, and opportunities risk. The risk appetite statement will define the board's appetite for each risk identified to achieve the strategic objectives in each financial year. Risk in NUHS will be managed within its risk appetite. Actions will be taken to reduce risk when it is exceeded. NUHS will periodically review its appetite for and attitude to risk. It will set risk tolerances at different levels of the organization, thresholds for escalation, and authority to act and evaluate its capacity to handle risk. A period review to assess risk maturity will enable the board to determine organizational capacity to control risk. Components of review include risk leadership, people, risk policy and strategy, partnerships, risk management process, risk handling, and outcomes. Tolerances for each management level of the risk management framework will need to be defined for staff and recorded. NUHS risk appetite statement will be communicated to staff involved in the management of risk. The board is responsible to lead and support risk management across NUHS. The underpinning principles include an open, objective, and supportive culture, acknowledgement of the inherent nature of risk and its existence in all areas of work, staff actively recognize and reduce risk, existence of an escalation and de-escalation process to communicate risk, and ability to learn from mistakes. Each department or area in NUHS will undertake a robust assessment of risk that may impact the delivery of high quality, effective, and safe care. The formal governance process illustrates the escalation route of risk, but the responsibilities and accountabilities for risk management fall on every employee in NUHS. A structured approach to risk management is adopted. Risks are identified, assessed, and controlled, and if appropriate, escalated or de-escalated through the governance mechanism of NUHS. Risks are managed in the following key stages. Stage 1. Clarify objectives. Objectives are clarified to recognize and manage potential risks, threats, and opportunities that hinder the achievement of strategic objectives. Identify risk to objectives by working collaboratively with colleagues. Guiding questions may include: what are the risks which may prevent the delivery of your objectives? What risks impact on the delivery of high quality and safe care? Is it an operational risk or a risk to strategic objective? Stage 3. Describes risk and assign control. Risks are described in a clear, concise, and consistent manner to enable execution of control, actions, and plans leading to risk reduction. The recommended standard for recording risk include risk, cause, effect, and impact. Risk describes something uncertain and may hinder NUHS from meeting its objectives. Cause is the issue leading to the risk. Effect is the result if nothing is done to mitigate the risk. Impact is the macro effect on the objectives if nothing is done. Preventive measures are taken to decrease the likelihood and consequence of risk severity. Each control must have an assigned owner and targeted completion date. Practical steps need to be documented. The 5 T's: tolerate, treat, transfer, terminate, and take the opportunity provide practical considerations in managing risk. In most cases, risks are treated and the associated cost to the action should be proportionate to the risk it is controlling. The action may introduce new risks and others need to be informed or they are impacted. Contingency plans need to be in place if the risk has occurred or is rated as high. All risks and controls need to be recorded in the NUHS risk register. Completing the risk register. NUHS risk registers are stored electronically. The process for completing risk register is shown in the figure indicated with an arrow. Headings to be completed in the register are shown in the table on the right. Escalation and de-escalation. The consequences of risk or the actions to mitigate them might require escalation to a higher management. Risks are escalated to or de-escalated within the defined authority to act at each level. The bottom right-hand figure provides an example how risk can be escalated or de-escalated. Risk owners need to seek approval from manager who consults risk register owner before risk escalation to a higher level. Risks are reassessed at that level against the objectives. The escalated risk will be de-escalated when it has reached its accepted target for the risk. Risk profile is a geographical representation of all risk utilized in reporting to increase visibility of risk. This provides managers an overall impression of the total exposure to risk. An example of risk profile is shown in the figure on the left. Project and programmed risk is managed similarly as other risk in NUHS with risk registers or logs. Risk management guidelines should include identity of owner of a program or project, additional benefits of adopting risk management within the program, nature and level of acceptable risk, escalation links and delegation from the program, mechanism for monitoring, inter-project dependencies, and interrelationships between strategies, policies, and guidelines. Financial cost for risk materializing and mitigating risk should be calculated and recorded. The NUHS governance structure identifies the relevant committees and their relationship to the board. Specific responsibilities in relation to this strategic approach are monitored by committees such as Finance and Performance Committee, Audit Committee, and Quality Committee. A management forum should be in place for each division, clinical directorate, and corporate area to hold discussions. Risks are monitored at an operational level such as the ward, clinic, and service through meetings and forums. The board reviews risk through three interlocking mechanisms. They are the recommendations and steps stem from the International Organization for Standardization 31,000 published in 2009. This framework encompasses the risk management principles and provides structure to organizations in their approach to risk management. NUHS needs to take in consideration of the size, nature, and complexity of its organization and align with other corporate activities in the initiation. The evolving nature of healthcare environment has changed the function of risk management professionals from employing tactical skills to developing and implementing change. The role is presently more provocative than reactive, and the challenge remains in providing good quality healthcare given finite resources such as finance, human capital. I've come to the end of my presentation. Once again,